Nearly 85,000 babies are born in Washington every year. Those newborns are eligible for 2 tests through a newborn screening program that detects infants with serious disorders. However, the COVID-19 pandemic has impacted the screening program.
And babies who miss this test could potentially be in life-threatening danger. Peter Choi explains how the pandemic has impacted this program and why it's so important for newborns. Peter.
That's right. Now take a look at this right now. Now, in Washington state, more than 84,000 babies were born in 2019, and that's a pre-pandemic, and more than 169,000 tests were expected to be performed, but 40,000 tests are not done. Now, during the pandemic, which is 2020, nearly 83,000 babies were born, and more than 165,000 tests were expected, but in reality, only more than 158,000 tests were done. Now, while that decline of the 3,000 tests may not sound like much, healthcare providers said it's significant.
Most of them would cause serious long-term harm if they weren't detected.
Cindy Roberts Hollon, Pediatric Nurse Practitioner in Spokane County, says early detection of the disorders could protect or even save your child.
When I'm talking about, like, how are the neurons forming, how is the child growing, how are they eating, how are they gaining, how is the nutrition getting to their brains, all of that is relevant in a lot of those diseases.
All babies who are born in Washington state are legally required to take first screening within 48 hours, detecting 32 disorders to prevent serious complications later on. The screening program temporarily suspended recommendation to collect second test results on April in 2020 due to COVID-19.
Uncertainty about what it looked like. There's a lot of fear, and we were struggling to know what the safest thing was for families.
That concern led the department to reverse the guidance a couple months later. If anything serious is detected on the first test, the director says the second test, about 7 to 14 days, is crucial.
The second screen really catches some of the severe forms that were missed on the first, plus a number of milder forms of the conditions that would benefit from early identification and treatment.
Still, some parents are hesitant to bring their child in for reasons only they may know.
Newborn screen was created because there were all of these diseases that are absolutely treatable, and if we don't test and find them, we can't treat them and make sure that their child, develops in the healthiest way.
Now, each state has its own list of tests that they require, and all providers are legally responsible to perform those tests unless parents refuse to due to religious belief or select ideology. In studio, Peter Choi for News Now.